So joining us today is Joe Kvedar. He is the Vice President of Connected Health Partners Healthcare. Welcome, Joe.
Great to be here.
Thank you for being with us. I have to start with the obvious. You are the man that first coined the phrase connected health, and we are, of course, sitting at the Connected Health Conference. What's it like to be here knowing that you're the father of the phrase?
Oh, it's wonderful, actually, and I'm just delighted that we came up with this idea in 2006 to really think that we were moving beyond traditional telehealth. And of course it's happened, and it's been adopted throughout the industry, and it's wonderful to see that.
Terrific. We know that you are a pioneer, as we mentioned. What was then called Partners Telemedicine has turned into Partners Connected Health. Let's look back even further than just the last few years. Look back over the last 20 years, and what are the major advances you've seen? What stands out to you?
Well, a couple of things. One is the ability to move information around. When I started, we worked very hard, for instance, to get data out of a blood pressure cuff. It was a dumb object. Now they're all connected, they're all wireless. That's one really important advance. And as we get more and more information from those sensors, we can do more with it in terms of predicting health, coaching health, etc. The second is the adoption of tools like FaceTime and Skype. Has been amazing, because patients now, including our octogenarians, Skype with their grandchildren. And so the idea that they might Skype with a doctor is not so far off. And as we move into that world where we're adopting more and more virtual care, that's pretty important. When we started, we did video, but it was with a large screen, 3 special phone lines. I mean, you had to go through so much, and now you pick up your iPad or your phone and you can video conference. And I think the last one is the change in the way we're being paid as providers. And that's only the last few years, but it's taking hold, this idea of value-based payment, because that opens the door for virtual care and makes the conversation about all these things we can do possible, because we aren't limited by seeing people in the office. We get paid differently now.
Yeah, it's a whole new world. So I want to talk with you about what every author wants to talk about, which is your new book, The Internet of Healthy Things.
Yes.
Tell us about the book and really what it covers in terms of strategies.
Well, it was the realization that by 2020 we're going to have 20 billion everyday objects that are going to be smart. They're all dumb now, they're going to be smart then. They're going to be connected, they're able to receive data, capture data, share data. And what will that mean for the delivery of healthcare? So that's what got us motivated. And then as we started to put it together, it became a bit of a, here's a tapestry of that opportunity, and where can businesses fill in the weave, or if you want to use a jigsaw puzzle analogy, what are the pieces? I have to say, over 20 years of experience, I have seen people trying to do the same thing over and over again, which is fine because sometimes the market changes, but it's not fine when they're doing the exact same thing and they just haven't read history. So part of this was also educating people about some of the mistakes made and areas not to go in, because there's so much that needs to be done. So in terms of strategy, it's really, we break it down into 3 areas. There's this idea that all of these healthy things will be new opportunities for us to individualize you, because your activity level is different than mine, your blood pressure is different than mine. All these things we can collect about you, where you go for lunch, how you spend your money. And so that will enable a whole new level of personalization. The middle part is the analytics that get us there. So thousands and thousands of data points will mean nothing unless we can put them together into a unique profile. And then the third part is how we engage with you around that. It has to be messaging that's motivational to you, that's compelling to you. And those are the 3 areas for innovation. And it turns out there's business opportunity in all 3 areas. And when we get to the end of that journey, healthcare will be different. It will be much more personalized. It will be a continuous function in your life. It won't just involve going to the doctor. We'll all be healthier, and people will be able to profit from that.
What is that experience going to be like, diving a little deeper into the patient experience or the person experience? You don't necessarily have to be a patient. You can just be a person to be living in this Internet of Healthy Things. What will day-to-day life be like within that construct?
you can start to get a glimpse of it, and I like the phrase, I think it was, I forget the gentleman's name, but he coined the phrase, the future is here, it's just not evenly distributed. William Gibson said that. And so if you use Google now, or the newest version of Siri, or Microsoft's Cortana, any of them, you'll get a sense of what this is like. So in the morning now, Siri sends me a message that says, it's going to take you 28 minutes to get to work, your first meeting is at 8, you should leave early. That's a flavor for how it will work, except apply that to your health. The choices that you make every day in lifestyle that are going to guide you to a healthier state, whether it be because you want to lose a few pounds, or you want to look more youthful, or you want to play more with your grandchildren. Whatever it is that motivates you to be healthy will be fit into that. And you'll get that ongoing messaging and coaching to help you get there.
Terrific. Another look into the future. What are the challenges in care delivery going forward, and what are some of the trends that you're seeing?
Well, there's a lot of challenges. I'd be wrong if I didn't say there's a lot of challenges. And it has to do mostly with inertia. We have practiced medicine a certain way, and in certain ways we've done it since Hippocrates. And most of us that are on the healthcare delivery side have done well. So when you're doing well, you're in charge, people think that you have some special knowledge, i.e. you're a doctor. That's a pretty tough combination for change, because who would want to change that? Sounds like a good gig to me. So we have to overcome some of that. Again, these new payment models are helping us with that. Another, I think, challenge is that we haven't made the technology consumer friendly enough. As much as I love all of this talk about things and moving data, if I have to pair something to my phone 5 times because the Bluetooth falls off, patients don't do that. We have good data that a consumer might do that because they want to use their headpiece, but for something involving your health, people just drop it. They go on. So we have to make it what we call wear and forget, or frictionless. That's another big challenge in the healthcare industry. And the analytics, I think, is probably one other one I'd call out here, which is right now the state of the art is people like Joe do X, so we therefore predict Joe will do X. That's from the advertising industry. That's how targeted ads work. It's not going to be good enough for healthcare. It just isn't good enough, because that will be offensive. It's one thing if you recommend a book to me on Amazon that I think is a laugher, I can laugh it off. But if you come into my life and you recommend that I do something health-wise that's either not on topic or doesn't fit in, it's offensive. It's that personal. So we have to get the analytics several layers better. A lot of opportunity. Watson is, of course, a big player. Optum Labs. Lots of people that are spending a lot of energy on this. In fact, the good news is they're draining some of the talent from companies like Facebook and Google to get into health. But we still have a ways to go on that.
Great. What are the exciting trends you see going forward? Which ones are most compelling to you?
Well, it's really exciting to see. For instance, we know that those people who get an activity tracker, for instance, something like a Fitbit or a Jawbone, on average will walk 1,800 steps more a day. So Fitbit just sold, I want to say 40 million of them last quarter, 409 million in revenue. They're doing well. They're doing well, and that's the first public company in this space, so we get to track them and stalk them, if you will. But again, there's some good there. So yes, people talk about buying the Fitbit and throwing it in the drawer, and of course that happens. But the fact that on average our population is now walking that much more, pretty interesting stuff. And those kinds of trends you'll see more and more of.
Terrific. Joe Kvedar, thank you for talking with us today.
It's been a pleasure.
Insights were wonderful. Thank you so much.